Back in 2011, we realised we had a huge cultural problem. Our LTIs were very high as a percentage of the workforce. Our absentee rates were very high. We recognised we worked in a remote location, not a lot for staff to do in the lunch hours, difficult for people to make the decision to come to work. That was costing the business money, time, and poor engagement with the staff.
We found that the biggest focus was on safety at the ports, and there was no focus on health. The focus just had to change. The leadership team came and spoke to our health and safety forums, and they asked the question, what else can we do for health and wellbeing within the business?
We decided consciously to increase the promotion of the annual health assessments, encourage the staff to participate, get them to learn more about themselves and how they can improve their outcomes.
So we identified certain people in the business that we could target as champions within the Healthy Lifestyle program that weren't prime athletes, but they were having a go. They were really interested in their health and well-being. People definitely motivate people. The Healthy Lifestyle program was a nice shiny box, and people wanted to jump on board and they wanted to be involved. They could see the changes in people and they wanted to have a piece of that.
What that did was focus more on health and wellbeing as much as safety. We found by focusing on health and wellbeing, it's a better preventative measure for safety incidents.
I've done the health assessment every year, and it sort of monitors, I guess, how your health is with blood tests and weighing in and everything. Being a man too, we don't normally go to the doctor until there's something wrong. That's when, I guess I decided I had to make some sort of changes, and I've lost, I think in 12 months now, about 35 kilos. So still got more to go, but I'm certainly enjoying it more now.
So through our health assessments, we've been able to identify the high risks, so things like too much smoking, too much drinking, not enough exercise. So we've been able to prioritise what we need to do within the company to bring those high percentages down.
Our Healthy Lifestyle program focused on other activities that would improve the outcome for the staff. So we built a gym, we introduced activities like healthy cooking programs, guest speakers to talk about healthy lifestyle options, and engage the staff more to learn more about themselves and how they could improve.
Short term, we look at our annual health assessments and we're able to identify our high risk areas and be able to evaluate those and decide what we need to focus on for the coming year. Some of the long term indicators we look at are LTI rates, percentage in claims. We take that back to our health and safety committees, which then feeds that back into the business.
In 2010, the Port of Brisbane would accumulated 45 claims to a value of $86,000 in compensation. Since introducing the program, in the last financial year, they've reduced to 19 claims at less than $36,000. We believe that health and wellbeing will contribute to the success of the business.
I think the port focuses a lot on health and safety. They're trying to instill a good culture of both. So if it's not something health related, then it's something safety related. There's a continual sort of momentum around it. The program itself sort of gave me the wake up call, and I've certainly found it very helpful for me.
People have got on board, they're getting out there, they're exercising, they're eating healthy, they're talking to each other about it. They love it. It takes time. Like, I've watched it since 2011, and you think nothing's going to happen, and then all of a sudden, pow, everyone's talking about it, and it's just a great achievement, and a great achievement for the Port of Brisbane to be able to have done this.